Managing a case of intellectual disability can be quite interesting. We should basically give an insight to the caregivers as well as the parents towards the diagnosis, what was basically the cause of this intellectual disability, which can basically range from an individual cause to even a syndromic cause, ranging from the Down syndrome, the Fragile X syndrome, the Prader-Willi syndrome, all of these syndromes, the autistic spectrum syndrome, all of these disorders can basically result in a low IQ again, and even the adaptive functioning of the individual, which can hinder the day-to-day activities of the individual, is going to be seen in this particular patient. So basically giving an insight to the caregivers, giving an insight to the siblings is very important. What should basically we reveal after the treatment options that are put forth the parents and the caregivers? One should basically assess that the patient should be more fruitful. He should have the lesser aggressive behavior. The IQ, even if it is low, it doesn't matter. More of the practical work can be indulged. And this is only done when the cognitive behavioral therapy is done, the counseling sessions are carried out along with the parents, with the patient as well. So the patient should be involved in the management. He or she should be given the treatment options, and to choose among these treatment options is again very important. If he or she is decisive enough or can basically suggest the treatment options as well. So this is the counseling, this is the doctor-patient relationship that a person should develop. The communication again over here is very important. Whenever you are carrying out the counseling sessions of a patient who is suffering from mental retardation or a low IQ, it's very important that you choose the perfect words, the perfect phrases that are more clearer to the individual who has a low IQ. So it's again very important. There are a lot of aspects to consider whenever we are dealing or whenever we are managing such patients. The communication skills, as we have already focused on them, they're very important. Open-ended questions should be there. And the health facilities that are providing basically all of these treatment options, they'll be discussed over here in this section as well. So the physical comorbidities, when we discuss about them, the oral hygiene and the dental diseases should be catered to. The gastrointestinal disorders should also be thought about. The gastroesophageal disease should be treated if it is present in this particular patient. And along with that, if there are any signs and symptoms of constipation, they also should be thought upon. Then we have epilepsy. If the patient has had any attack of seizures, it should be catered to as well. All of the investigations should be carried out in these particular individuals. Hearing problems if they are found. And obviously sometimes the IQ of the individual is quite normal or average or above average, but he has some hearing problems which is basically hindering the learning capabilities of that individual. So treating these hearing problems would solve a lot of problems as well. The short-sightedness, if it is found, it should be treated as well. A lot of psychiatric comorbidities, if they are present, they should also be dealt in with. For example, if a person is suffering from affective or mood disorders, it should be carried as well. If he's a patient of schizophrenia or attention deficit hyperactivity syndrome, which is characterized or symbolized as ADHD. And then we have the common issues in the management of these patients. Usually these patients are under-recognized there are a lot of under-recognized physical health problems in these individuals as well. There are a lot of behavioral problems involved in these individuals. For example, the epilepsy autism is also seen in these individuals. The mental capacity is noted down for these individuals as well. There are a lot of questionnaires out there which can be basically carried out for the IQ calculation for these particular individuals. So we can get to know about the IQ range. If the standard deviation is more than or almost 2 deviations, it is basically going to characterize the low IQ in these individuals. Aging population is again very important over here. If they reach a particular age, if they're not syndromic, only then they can reach that particular age. Little research evidence has been carried out. Professionals and agencies are working together towards their betterment. And there are a lot of psychotropic medications as well. Stigma is basically being attached to this kind of an intellectual disability. So parents basically won't speak about their child who is suffering from such kind of an autism or autistic syndrome over here. Self-injury is usually seen in these individuals as well. There are a lot of aspects to consider as well. The healing time is quite long. They need information from all sources. Home environment is preferred, and more than one visits are almost needed. They need home care as well, and together the behavioral data, the school data again is very important. Consent is very important. Mental capacity, confidentiality to keep all of this research and to keep all of this history taking confidential again is very important over here. The impact of the communication problems is very important over here. The level of disability should be assessed, the impact of suitable social environment should be assessed, and one should be aware of the diagnostic overshadowing. The behavioral phenotypes should be categorized as well in these individuals, and safeguarding of the vulnerable individuals. For example, if an individual is already suffering from a psychiatric comorbidity, he is more vulnerable. Through the premorbid conditions. The communications with the intellectual disability patients, the clinician should be more respectful and he should be more courteous towards these patients as well. They allow for more time, pauses are given usually by the clinician when he's counseling such patients, and the clinician should be more patient for the answers. Time should be given for the patients to answer the questions that are put forth by the clinicians. They should avoid technical terms or jargon, concentrate with information in plain English, ask one question at a time as well. They should provide instructions one at a time, step by step, and then checklists should be given to the patient as well. Rephrasing the questions again are very important, and use of the visual clues, paraphrase the back understanding and have one person repeat back their understanding. Provide the immediate feedback to the parents as well as the caregivers. The collateral history that is taken from the parents or the caregivers should be recorded, and the prescriptions should be recorded. The previous medical and the surgical history should be recorded as well. Collecting collateral information again is very important over here. The healthcare facilities that are providing these patients the helping hand out there, they include the outpatient departments, the supply of the necessary drugs, the laboratory X-ray investigations, domiciliary visits, hospitalization visits, and the specialist consultations if they're needed, pediatric services if they're needed, antenatal, natal, and postnatal services in a lot of cases. Emergency treatments are given to these individuals in a lot of cases. Deliberate self-harm is performed by them as well. A supply of optical and dental aids should be kept, just to get an overview of the oral hygiene as well. Family welfare services should be provided along with it. So basically in this section, we summarize the management plans or the treatment plans that can be devised for these individuals who are suffering from intellectual disabilities. So that is the end of this section. Thank you for watching sqadia.com.